Good morning. I'm going to run you through some of the theory of manual handling in this series of short lectures. Before we get started, just to remind you that these videos should be watched in conjunction with the veterinary nursing manual handling notes, which are available on the Introduction to Veterinary Nursing Moodle page. These cover the principles of manual handling and how they apply to veterinary practice. And I'm going to run through some applications of that now in a slideshow. So I'm going to divide this section into a number of short presentations. Each one will cover a different topic within the notes, and when viewed in conjunction with the notes, they should cover all the material you'll need to allow you to basically apply the principles to the veterinary workplace. Okay, so we're going to get started here by playing the slideshow. So manual handling for veterinary nurses, it's something that vet nurses do every day, and we probably don't even really think about it, but it's important to consider how to do it in a safe manner, both for yourself, but also for the people you work with and for your patients. So before we get started, just a couple of things to point out. I'm going to make this a bit smaller. This content is part of the health and safety module, which is a component of the Introduction to Vet Nursing module in semester 1 of the first year veterinary nursing program. So the content here is relevant to the module and also to some exams and assessment. You'll have a manual handling case report to do while on work placement, so it will form part of the assessment for that module. And you'll notice as we go through the notes, there's some blanks in them, so you can fill those in as you go along to help reinforce the theory for yourself as we're going through it. Okay, what are we going to talk about in this series of short lectures? We're going to be looking at manual handling, what is it and how do you do it, how to assess risks in the workplace, identify hazards. We'll talk a bit about anatomy and fitness that's relevant to being a veterinary professional. We'll mention ergonomics and I'll explain what those are when we get to that stage, and then we'll run through the principles of lifting and how to do so in as safe a manner as possible. I know this all sounds a bit boring. If you've done manual handling before, you may have pushed a box of photocopying paper or lifted it on and off a table. I know it doesn't sound the most exciting thing, but it is important to keep in mind just how important it is to your chosen career. There's this old saying, what do you call a nurse with a bad back? And the answer is, unfortunately, unemployed. So why do you have to do it? We basically want you to work in practice without getting hurt, to have a long and successful career. You're also less likely to injure other people, either your colleagues or clients or your patients. It's also more efficient. Injured people work slowly or have to take time off work, and it's not conducive to an efficient workplace. And then, as we've mentioned already, we want you to be able to go on your work placement at the end of all this. So learning outcomes, I mentioned these in relation to the introduction talk I gave to you in induction week. We mentioned these are the things we want you to be able to do at the end of the module. They're practical things. So in this case, we want you to be able to use the principles of manual handling and actually apply them in the workplace and in your daily life. So that's the outcome. You'll be able to actually lift things and move things without increasing the risk of injury to yourself or others. To help you achieve this, I've put some resources in the notes. The Health and Safety Authority, or the HSA, is the main Irish regulator of the sector. There's some other resources that are relevant as well. I've put them in a list in the notes and on the Moodle page. Just really important thing to bear in mind, especially when you're doing assignments, is that avoid talking about UK or other overseas guidance or legislation. It doesn't apply to Ireland. It's not relevant to the Irish workplace, and it doesn't give you any marks in assignments. So there's no point telling me all about the health and safety laws in the UK. They're not relevant or applicable here. So it is important when you're researching assignments, make sure that the information you're drawn from is actually relevant to the place you're talking about, which in this case is going to be Republic of Ireland workplaces. Okay, so if we start off by talking a bit about manual handling itself, what is it and what do we mean? And really, you can see in this photograph here, it's my colleague Darren and two students, stomach tube and a calf in Ballyhaise. So you can see Andrew here on the right is having to restrain the calf, Sean is passing the stomach tube, and Darren is checking placement of the tube in the esophagus. And they're working together to complete this task. As you can see, they're all bent over, they've had to restrain the calf in the corner, and Shauna here is being careful that while she's using her hand to restrain the calf's head, she's not obstructing its airways. So she's not going to hurt it or cause it to panic. So really, we're talking about lots of day-to-day patient care and practice jobs that require us to use our bodies to complete them in some way. So by manual handling, there is a definition in the notes on page 6. You can have a look at that. It's quite wordy. I prefer something a bit simpler, so I tend to think of it as using your body to move something. I think that's a really simple definition of it. That's what I tend to work with. And as we've mentioned, it's really important to remember this is something that you will do every day. It's a fundamental part of veterinary practice. So you might think about manual handling in terms of moving loads. I've got some boxes here of fluids and veterinary supplies, consumables. These will arrive at your practice and they'll be delivered, and then you need to unpack them and check the invoices and store them safely away. So that's kind of what we tend to think of when we mention manual handling. But it's a lot broader than that. It's things like using equipment safely. So in this instance, I'm using a stepladder to place items on a top shelf rather than trying to precariously climb up there. Also, you can see here these two nurses restraining this dog. They're working on the floor, so they're having to bend down and restrain the animal while they perform whatever clinical assessment they need to do. In this case, they've put the dog onto a table. See, the nurse on the right is restraining the animal's head and forearm, while the nurse on the left is, in this case, placing an intravenous cannula. So these are all examples. They vary widely depending on the type of practice you're in. So this is someone who's responsible for nursing large animal patients, in this case, drenching a cow with some water. So again, you can see the need to be able to restrain the animal's head and safely administer whatever it is you've been asked to do. Depending on the size of your patient as well, it may be several people involved. So in this case, this person on the left is blood sampling this ewe while she's got two of her colleagues to restrain the animal. You can see this person here on the right in the green jacket. She's carefully keeping the animal's head still and against her body. She's gripping the head, but she's doing it in such a way that she's not putting any pressure on the animal's airways. The nostrils are clear. She's not pressing on the windpipe, so the animal isn't going to panic. Another thing to note is that ideally this person on the left who's collecting the blood sample should be wearing gloves to avoid transferring her skin flora onto the skin and injection site in the ewe. Other examples, this is a class from a couple of years ago where we've got some students working as a team to restrain this large snake who's too heavy for one person to comfortably hold, but it's much easier when you use a team-based approach, as you can see. In terms of where we find legislation, the Safety, Health and Welfare at Work Act 2005 sets out most of the rules that are going to govern how we apply manual handling legislation in the workplace. You don't need to be an expert, you don't have to learn the legislation off, but it is important that you're aware of it and can follow through on it and act on it correctly in the workplace. So that's as far as I wanted to go at this point in terms of talking about manual handling, what it is and how you do it. And the next section we're going to go on and talk about then is risk assessments. I'm going to pause here now, finish this recording and come back in a few minutes to do section 2. Thanks for your attention so far.